Famciclovir is a medication used to treat infections caused by certain types of viruses. It can be used to treat shingles caused by herpes zoster, as well as outbreaks of herpes simplex that cause cold sores around the mouth, sores around the anus, and genital herpes. For people who experience frequent outbreaks of genital herpes, famciclovir can help reduce the number of future episodes. This medication is an antiviral drug, but it is not a cure for these infections. The viruses that cause these infections continue to live in the body even between outbreaks. Famciclovir works by decreasing the severity and length of these outbreaks. It helps the sores heal faster, prevents new sores from forming, and reduces pain and itching. It may also help reduce how long pain remains after the sores heal. Additionally, for people with a weakened immune system, famciclovir can decrease the risk of the virus spreading to other parts of the body and causing serious infections. The usual daily dosage and timing for taking famciclovir may vary depending on the specific condition being treated, so it's important to follow the directions given by your healthcare provider. It's important to take the medication exactly as prescribed, even if you start to feel better. This will help ensure the medication is most effective in treating the infection. Make sure to read the patient information leaflet from your pharmacist before starting famciclovir, and ask your doctor or pharmacist if you have any questions. Take this medication by mouth with or without food as directed by your doctor, usually 2 to 3 times a day. It works best when started at the first sign of an outbreak, as directed by your doctor. The dosage is based on your medical condition and response to treatment. Take this drug at evenly spaced intervals to keep the amount of drug in your body at a constant level. Remember to take it at the same times each day. Continue to take this medication until the full prescribed amount is finished, and do not change your dose, skip any doses, or stop this medication early without your doctor's approval. If your condition lasts or gets worse, be sure to tell your doctor. Some common side effects of famciclovir include headache, nausea, and diarrhea. If these effects persist or worsen, it's important to talk to your doctor or pharmacist right away. It's important to remember that your doctor has prescribed this medication because they have determined that the benefits outweigh the potential risks. Many people who use this medication do not experience serious side effects. However, it's important to seek medical attention if you experience any serious side effects such as changes in mood, dizziness, signs of kidney problems, yellowing of the eyes or skin, or easy bruising/bleeding. While a serious allergic reaction to this drug is rare, it's important to get medical help immediately if you experience symptoms such as rash, itching or swelling, severe dizziness, or trouble breathing. If you notice any other effects not listed here, it's important to contact your doctor or pharmacist for further guidance. Before taking famciclovir, make sure to inform your doctor or pharmacist of any allergies you may have. This medication may contain inactive ingredients that could cause allergic reactions. It's important to discuss your medical history, especially if you have kidney problems. Famciclovir may cause dizziness or drowsiness, especially when combined with alcohol or marijuana. It's important to avoid driving or operating machinery until you know how this medication affects you. Limiting alcoholic beverages is also recommended. If you use marijuana, be sure to talk to your doctor. If you have conditions such as galactose intolerance or severe lactase deficiency, consult your doctor before taking this medication, as it may contain lactose. Before undergoing surgery, be sure to inform your doctor or dentist about all the medications and products you are using. It's important to note that famciclovir does not protect against the spread of genital herpes. To reduce the risk of spreading herpes to your partner, avoid sexual contact during an outbreak or if you have symptoms. Always use effective barrier methods during sexual activity. If you are pregnant, discuss the risks and benefits of taking famciclovir with your doctor. It is unknown whether this medication passes into breast milk, so consult your doctor before breastfeeding. When taking famciclovir, it's important to be aware of potential drug interactions that could affect how this medication works or increase your risk for serious side effects. It's recommended to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. It's crucial to not start, stop, or change the dosage of any medicines without your doctor's approval. This will help ensure the safe and effective use of famciclovir. As always, follow your doctor's instructions and guidelines for the best results. If someone has taken too much Famciclovir and is experiencing severe symptoms like fainting or difficulty breathing, it is important to seek immediate medical attention. In the U.S., residents can call their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. It's important not to share Famciclovir with others, as it has been prescribed specifically for your current condition. Do not save it for another infection unless instructed to do so by your doctor. If you forget to take a dose of Famciclovir, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. Don't take a double dose to make up for the missed one. Remember to store Famciclovir at room temperature, away from light and moisture. It's important to keep it out of the bathroom and away from children and pets. When it comes to disposing of Famciclovir, don't flush it down the toilet or pour it into a drain unless instructed to do so. Make sure to properly discard this product and it is expired or no longer needed, and for guidance on how to do so, consult your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.